Well, many people suffer from misaligned feet, and the symptoms that could follow could be detrimental down the line. However, Dr. Tracy Ferragamo from the Davis Podiatry Center is a master surgeon right here in our community who has been trained and certified to perform a breakthrough, minimally invasive procedure to correct this very condition. So big warm welcome to you, Tracy.
Thank you, Melissa.
Yeah, so tell me more about misalignment of the feet.
Well, misalignment of the feet. This is a very common problem affecting a lot of folks of our population, estimated 50–60%. And misaligned feet occur when the ankle bone loses its alignment or stability on the heel bone. Melissa, we're talking about overpronation. We're talking about collapsing arches, falling arches.
Okay, so because you hear those terms a lot, you hear about overpronation and collapsed arches a lot, but that is basically misaligned feet. What are we looking at right here?
Well, this is a photograph of a patient that I met recently in my office.
Okay.
She came to me with a lot of pain in her feet. She had a very hard time participating in normal activities, including in school, in high school, and PE even. So I wanted to show you this. This is a collapsing arch, misaligned feet.
Okay, so you can see in this photo too how the ankles are severely in versus the heel, right?
Yes,
okay.
right. Now this is a clip of the process of the arch falling. So you see there it's falling, okay? So it starts out with an arch, and then as we take a step, this person is simply putting weight on the foot. You can see that arch falling. On the other side is the fluoroscan scan of actual movement of, you can see that arch bone.
Oh, no
right
way.
There. You can see it collapsing. Okay?
You can see the compression of the arch bone. And would you call this flat-footed then? Is that what that would be?
That's another way to put it, yes.
Okay, flat-footed. So what are the problems then if somebody has that type of condition? What could happen to that individual?
Well, what could happen to that individual is a lot of conditions can occur, including heel pain, arch pain, plantar fasciitis. Bunions are usually caused from misaligned feet. Shin splints, growing pains, tendinitis causing pain on the inside of the ankle, knee pain, hip pain, and arch pain.
Really? Okay, so if somebody has some hip pain or a knee problem, it could actually be something associated with their foot.
Yes, you know, the feet are the foundation of the body. They're at the bottom of the skeletal chain. So if the feet are misaligned, it can really cause a torque on the other joints throughout the body.
On everything else up the line.
Yeah.
Literally. Yeah. So we literally have to have a strong foundation.
Right.
And if the foot itself has an issue, then it's just inevitable that something else is going to be happening, you know, up the leg all the way to the hip, like you mentioned.
Right. In fact, I think we have a clip of that.
Of the line, yeah, and I think
skeletal alignment there.
Yep, yeah, and I think we were just showing that where it goes from the foot up to the knee, up to the hip. Yes.
Okay.
No.
Good.
We saw it. Yeah.
You're on it.
It's my next question though for this though is if the foundation itself is having issues with the misaligned feet, then is this something that can be corrected or fixed? What do we do?
Yeah. Well, it certainly can be corrected. There is a lesser known procedure that I've been doing for 10 years in my office. We've done hundreds of them. And what happens is we place a stent. It's a titanium stent. The procedure, it's called hypercure.
Okay.
Hypercure is a titanium stent that's placed in a naturally occurring space under the arch bone.
Oh.
Okay. And by the way, it doesn't go off at the airport.
Oh, really?
Yeah.
Okay, that's good to know. That's very important.
Question.
Okay, so hold that up a little bit higher for me. Okay, so we're talking about this space right here.
Yes.
Which is the arch bone. And then the titanium implant that you have right there just goes simply in there. And what does that do then for the support?
Well, what happens with a falling arch is this arch bone here slides off of the heel bone. Here's the arch, and it slides off of the heel bone.
All right.
Okay? And so this stent is placed in a naturally occurring space through a very small incision, about an inch, into a canal. It's not into a joint, and it does not go, there we go, and it does not get drilled into a bone. Those threads are to wrap around the soft tissues to hold it in place.
Wow, that's fascinating. Okay, and then you have some before and after pictures too of how this has helped people.
Yes. So here's the patient that we talked about earlier, and here is, we should have a picture of following
Okay, so post procedure. So this is before procedure, where you can see the ankle over, and then oh my goodness, wow.
Yes.
Okay, and the benefits clearly of this is that the pain goes away. Now I imagine your knee and your hip alignment's better, and you're able to function and do all kinds of activities that you weren't before.
Right. Yes.
Okay.
Yeah.
So where can our viewers go for more information?
Well, the viewers can go to my website, davispodiatrycenter.com, or call my office in Davis at 530-753-9080, and my awesome team will take good care of you.
Wonderful. Tracy, thank you so much. Such a pleasure to meet you.
Thank you so much for having me.
Absolutely fascinating. Oh, that's awesome.